good morning from my side too. I'm really happy that we can start today's conversation about the intersection between culture, health, and social care. And we want to start the day with a little bit of wider context, reaching into what the development of this emerging field of practice has been knowing in the recent years, both at the level of practice, but mostly at the level of policies. So this is why we have here a distinguished panel. We have, you may recognize from yesterday, Monica Urian, who's the policy officer in charge of culture and health portfolio at the European Commission. We have Edith Wolf-Perez, who is one of the co-founders of the Arts for Health Austria organization. And we also have a representative of the medical sphere here through Mr. Sebastian Armean, who is, let me see if I can put it right, yes, is Vice Chief Medical Officer at the Clinical Hospital for Infectious Disease. Yes. Okay. I always wondered when I walk past your hospital if you're every day kind of scared of getting infected. Do you?
Well, good morning to each and every one of you. This is a really funny joke because not about getting contaminated with infectious diseases. I work as a psychiatrist. I'm certified as a senior psychiatrist and also as a clinical pharmacologist. But the fun fact is, when I started my training in psychiatry, none of my colleagues from the same group of the Faculty of Medicine wanted to come to visit me, okay, because they thought we'll get infected with psychiatric disorders. And I told them, yes, but 5 months ago when we were in medical school and you had your psychiatry module, you were here and you didn't get, yeah, but this is something else. Okay, so, but to be honest, I always was a little bit afraid of germs. You can call it misophobia. It's not like that I don't have a disorder, I hope. And funny thing is, I started working in the Clinical Hospital of Infectious Diseases.
Well, we'll talk about later about bringing artists into that environment. Monica, could we ask you for the beginning to give us a little bit of an overview for about what is going on at European level and especially how the policy landscape is happening and modeling?
So good morning again. Bună dimineața. Yes, there is a sort of a virus going on in this field because culture and health is really taking off as a cross-sectorial collaboration, which is really the least obvious maybe from everything that I have seen in culture policy so far, because of course culture and research is very easy to understand, culture and social affairs, regional policy, international relations even, it's quite organic, but culture and health is like the least organic and the latest addition to the family of what we call mainstreaming culture policy into other EU policies, where we come and bring ideas from the cultural field, and also we get funding from other programs of the EU. So on the 29th of September, I had the privilege to be in Barcelona at the Mondial Cult Conference, you know, this world culture policy conference organized by UNESCO, and that's where we launched this report that we are going to tell you about together with Edith. It's called Culture and Health, Time to Act. And there we were with the Commissioner Glenn Mikalev, with the Minister for Culture of Spain, Ernest Urtasun, and with a director from the World Health Organization, and a representative of UNESCO, and also a representative of the culture sector and voluntary sector from Latvia. So it was really a way to show how important this topic is, and that we really made it to the sort of almost mainstream discussions now. But we still have to fight a lot to keep there and to keep in the spotlight. And together with Edith, we thought we were going to tell you more like stories, because we had a lot of theory yesterday and a lot of more abstract things. What is important to remember is maybe that everything started, I mean, a lot of things started here in Cluj. You know, when the Cluj Cultural Center was in contact with the European Parliament, who has this power to present to the Commission a list of pilot projects and preparatory actions which are not covered by our regular programs. In this case, Creative Europe, and they came with this idea that culture and health should be connected, there should be research about it, and there should be pilot projects. And we had the chance to, so this discussion started in 2019, and the Romanian members of the European Parliament agreed, and they put this idea forward, and it did, as we were not working on this topic at that time, it became a preparatory action. And with just €500,000 from the European Parliament, which is an extra budget not coming from Creative Europe, we managed to create a little miracle, and to come up with this extensive research, which was building on the 2019 report by the World Health Organization on how arts and health are connected. So basically from 2019, the WHO started with this, they were the pioneers, and yeah, I will never be grateful enough for the medical profession, or at least the WHO environment, to come up with this. They have an office in WHO Europe in Copenhagen, which is quite a visionary one. So they started the process. Then we came up with the preparatory action. It was full COVID time by the time the Parliament brought this idea forward, and we found the funding, the management of the funding, and we had this consortium implementing this preparatory action. And there it was already clear that culture and health are really connected by the way we survived during COVID times, and also, as we talked a little bit yesterday, how the artists themselves tried to survive during the COVID times. So it became something a little bit more accepted as an idea. And then with the report that was published by Culture for Health at the end of 2022, and the pilot projects that we had, like music and motherhood here, like music in intensive care units in Denmark, and so on and so forth. There was this movement inside the EU, or at least in the Commission, which started to recognize this this connection a bit more. And then, of course, in the meantime, the member states, because in the European Commission we do not have how to say the responsibility of cultural policy. It's the member states that do. We had already interest from the member states, and there was this topic of culture and health in what we call the work plan for culture, and in the current one. So it's an EU work plan for culture, where the Commission works with the member states to implement the main topics that we collectively think it's important. We had this open method of coordination group working on culture and health, which means that for the first time, experts nominated by the Ministries of Culture and Ministries of Health from the EU member states came around the same table, and they discussed for 1 year and a half what is culture and health, why is this important, what are the challenges, the opportunities, what are the good practices, and how to move forward, what are the policy recommendations, because us in the Commission, we really need both the civil society through culture and health for health and the member states to tell us what to do, and then we can act on it. So the way to move forward in this direction, just to start this conversation, was that a lot of different actors came from their own area of expertise and their own area of influence. Of course, it's a question of lobbying, if you wish. And together we built we brought our own bricks. So the parliament brought the budget and the idea, which it was your brick actually. And then we brought the implementation, the support. We hosted this OMC group, which Edith chaired. And in the meantime, of course, in terms of funding, you also have to act in order to give more and more projects the possibility to test solutions, to do more research, to do more training, and so on. So in the Creative Europe program, in parallel, we also introduced culture and health as one of the objectives, so to make sure that there is a critical mass of projects that brings this idea forward. Otherwise, it's just us talking, theoretically in a corner, and it doesn't have enough impact on what we want on people. So maybe I will stop here for now, and I'll give the floor to Edith to tell more about the OMC process, how she felt about it.
Thank you. Thank you, Monica. It was really exciting because I think we had at least at one meeting members of every member state, so representatives of every member state. This is just an achievement that Monica did. She really put all the effort in that all the member states would be represented in this OMC group. Now, to repeat, OMC is this open method of coordination where the member states work together and they learn from each other. So what did we learn? We learned that the intersection of culture and health on the structural level only exists in very few member states. So there are agreements between the culture sector and the health sector in France. There is an agency, Taikusedan, in Finland. But if we don't have the structures, we have in all the member states an incredible practical field with lots of examples and lots of initiatives and lots of projects happening of culture and the arts in the health sector. Now, the premises we worked on were the following. Monica said it's not logic that you connect the arts and culture with health. Well, I think that's something that we have forgotten. It is very logic. Because when you go back to prehistoric times already, you have the evidence or the science that the arts and well-being and health were connected. I mean, I'm come from Austria. We have this 30,000-year-old little statue, like the Venus from Willendorf. And you look at this is a little statue, so they always said this is a ritual sculpture. Well, it could also be something that you have in your hand that soothes you, especially because this is a woman, apparently in a very fertile condition. So it could be for women to soothe themselves when they are pregnant, for instance. Whatever, we don't know. We're just speculating. But also the arts, when you look anthropologically, the arts are a way of making sense of our world. When you look at the cave paintings, what did they do? They looked at ways how to connect their experiences with an expression of their experience. And so I think we have forgotten how logic the connection is, and we're trying to get that back. So for us in the OMC group, Culture and Health, we said the engagement in the arts and culture are a health behavior. As physical activities are good for our body, as well as a good diet is good for our system, so are the arts good for our health and especially for our mental health. To arrive at the policy conclusions or recommendations, that was the mandate, to come up with recommendations how to facilitate the collaboration between the health and the culture sector. We identified the challenges that we are facing in the health sector, in the cultural sector, and globally. Now, these would be, for instance, the financial challenges that we have, the demographic development that we are facing in the health sector, the expected rise of non-communicable diseases. We haven't talked much about the communication diseases, so like germs, and so we didn't go into this field, but maybe you can add something about that. And the challenges for the culture sector is what we talked yesterday, the precarious funding situation, but also how to avoid instrumentalization of culture, how to react to the digital disruption, and how we can guarantee for equity, diversity, and inclusion. And the culture for the intersectoral collaboration is the insufficient practical support and the leadership of intersectorial collaboration, fragmented governance structures, like you have the health sector, which is a fragmented field, whether you have a centralized government or you have a federal government. So it's really difficult to find your way in these systems. Anyway, we found 21 opportunities for all of these sectors, and also to address the global challenges that we face, like we are now in a situation where war is very close, is back in Europe, where we have a disruption of democratic processes. So all these conditions that we are facing now, there are some help that we can get, or support that we can get from the arts. And that's also part of the report. With these 21 opportunities, we said, well, actually, it's time to act now. And we came up with quite concrete recommendations for the member states to realize on the European level, but also in the member states. As Monica already said, we have these recommendations were built on the evidence, and the scientific evidence which were provided by the WHO report and the Culture for Health report on the policy development so far, but especially on the practical field. What do we have there? What is the experience? What works? What doesn't work? We think that with this report we have come quite a big step in the development, and as Monica also said, it was presented in Mondia Cult by the Commissioner of Culture, Glenn Mikalev. And as a result of this presentation, Spain already signed an agreement between the Health Ministry and the Culture Ministry to consider culture and the arts in the healthcare system and especially for mental health. So we're very happy about this development, and now it's up to the member states to work with this report if they feel like. We encourage all the member states to launch the report, to make it public, to bring it into discussion. Now we have in Austria, we will do that in January, and we are here now, and maybe Romania will make a launch, so I encourage you to go to the ministries and talk about it and encourage them to present the report. And because it is really a win-win situation for both sectors. We can really help each other out. What is there? But the learning continues. I mean, we are in a learning process constantly, and this is continuing here. And this this forum is one of the best examples how to continue the discussion, how to go further into the topic. And the other example is the Culture and Health platform, where we have now a membership of 40 members or something, yeah, and try to network across Europe to take in this topic. So, thank you.
Thank you. I'm just curious, can you name one or two of the existing policies in member states that you are, you find as really good examples?
Yes, I said France. Like France has a memoranda of understanding between the health sector and the cultural sector, and they work together to devise programs and projects. But they have, I mean, what they have, and that's really unique, it's not only that they have, the culture sector has agreements with the health sector, they have it in the educational sector, and they have it, so culture in all policies. It was very interesting when we started these discussions in the OMC group, and we asked the French colleagues, how do you see the role of culture in the health world? A colleague from the Ministry of Health said, mais bien sûr la culture. So she was sort of, the culture is organically necessary in the health sector. There is a different understanding there. The other example maybe is Finland, which I mentioned, where they have really a cross-sectoral agency that's sort of an interface between the health ministry and the cultural ministry, working together with the universities on the evidence base and the practical field for the projects. So this is also a very good example and has been it exists since the 2018 or something, Taiku Sidan. Well, it has quite a history already. And of course the UK, but the UK is not part of the EU anymore, so shall I talk about that? Am I allowed to talk about that?
Yeah, sure.
Okay.
You can speak about Australia.
That's where actually my experience goes back to the 1980s, where I already worked as a dancer in hospital, in psychiatric units, and with inclusive dance companies. And it wasn't. It was the other thing that I forgot to mention or should mention is that we are talking about the intrinsic value of the arts and culture. And within this culture and health field, the arts-based therapies or the arts therapies or the creative therapies have a very special role to fulfill, because they should have a therapeutic approach to it, which the arts, when practiced by artists, don't have, because they are not therapists. So I think we should be, when we develop the field, we should be quite clear what is our role, where can we, how can we make a contribution, in which areas, and how. And I think we also have, it's good to distinguish between the culture and the arts in healthcare and as a prevention and health promotion. And these are the learning steps that are now really necessary to advance the field.
Thank you. Monica, you wanted to add some examples?
Yes, maybe to recall another recent example is in Greece, where they started a pilot on culture-based social prescribing. You know, social prescribing is very large. It can be walking in a park, walking your dog, etc., but or volunteering, but only linked to cultural activities. It's called culture-based social prescribing. And so Greece piloted this project and is launching it on a national scale, working with a lot of mental health institutions, with universities, and of course with different cultural organizations. And this was also including in the Recovery and Resilience Funds proposal. So just like in Romania, the status of the artist legislation, or of the cultural workers, sorry. Yeah, but in terms of France, I mean, they've been working, I think, since 1999, if I recall well. So, you know, there is a tradition. My advice to people who are starting is just start. Start, because you don't need to wait until everything is perfect, until all the health profession is convinced, until all the cultural workers are convinced. It's never gonna, we are not there, maybe we will never be there, but as long as you have the right ambassadors who can be the champions for your cause, in this case, this cross-sectorial collaboration, any step forward is a good one. And you know, in Spain, they have this new agreement between the Culture and Health Ministry, which was in the context of the Ministry of Culture taking the lead. It's often the case, with their cultural rights national plan. So there they discuss about a lot of things, artistic freedom and so on, diversity and well-being and health. And again, they are launching as well, as far as I saw, how to say, a national website for cultural-based social prescribing. So this seems to be like a sort of easier to implement model than other more, how to say, less researched models in this field.
I just want to say, for those that are not familiar maybe with what social prescribing means, it means that you go to your doctor, and the doctor may prescribe, just as they can prescribe physiotherapy, they prescribe an activity that, as Monica said, could be nature, connection with nature, but it can be participating in a cultural activity for a number of sessions for a while, because that provides so it's proven, it's based on scientific evidence that supports psychosocial recovery for people with different type of conditions. And I want to touch on one of the things that you mentioned, Edith, earlier, that now we have again, it's based on evidence that culture is a health behavior. So it's the University of Florida that has a center for arts in medicine, that has a strong research group there. And they have published, I think, in 2023, an article giving the arguments why culture can be considered a health behavior. And on one hand, is that it could be, from a certain paradigm, we can see culture as a social determinant of health. But if we look at health from a socio-ecological perspective, we can see that it's the health of an individual may depend on their genetic predisposition, but it also depends on their family and community conditions, from environmental factors, nutrition, but also interactions and toxic social interactions are an important factor for disease. And the cultural context is also one of the factors. So what are the types of prejudices in the communities that we live? What is the level of access to culture becomes now a relevant factor. So this is the moment when I'm turning to Sebastian and asking, how does it all sound from the perspective of a medical professional? We know that we are currently in a crisis. I mean, especially when we talk about mental health, but we know that in general that health institutions are overburdened. How do medical professionals react to the idea of having the arts around?
Well, I think we are always on a crisis, so crisis would be something normal, because each day we have to change something in our behavior, and then by our small change we change something in the world. And I really like what you said, when you don't have to wait for everything to be right. When I was a member of the IFMCA, International Federation of Medical Students Association, our motto was think global, act local. So basically what we did we had a meeting, you had your convention, I think, somewhere in September or late October last year here in Cluj. I met with Amir at an informal dinner. He talked to me about social prescribing, cultural prescribing, and then last December I had a meeting with the conductor of the Medical Students Orchestra at our university, and we had a joint venture. They came with the band and in 2 occasions before Christmas last December. So what we did, we brought culture into our hospital, okay? And it was an action desired. We didn't know how it's going to act. They just came. We said, okay, we're gonna have the concert here because the hallway, the grand hallway, seemed suitable for this. And Vlad, my colleague, the conductor, said we're going to come 2 times, once with the instruments and another time we're going to just play carols, just sing them. And I said, okay, let's do it. And it was such a success. We intended it to be at noon. It was designated for patients, hospital staff members, for anyone who was there. And this is a pinpoint that you said that we don't have access to culture, because when we're going to leave here, we're going to think that we have bills to pay, kids to feed, nurture, and culture is something that we're going to do it next Sunday, because now we have to buy other stuff. So this is why I think each day we turn into crises. But it's our perception of how we can keep calm and just take one step at a time, or the bricks. I really like that comparison with bricks to put it on. Of course, we want to have like a good, strong collaboration, a partnership, or a memorandum of understanding between all the political factors. But if we're going to wait for this, I think nothing will happen. Because each time you have something else. Now we have the flu epidemics, then we'll have something else. So each time it seems that something is more important. But I think that we're confounding importance with urgency. Okay? These things are urgent because they'll come the next year. But if you start building something on a long term or short term, then I'm sure you're going to see successes. And going back to our experience with the 2 concerts, before the Easter holiday, we replicated it. And now we're going to do it again. And our colleagues are asking when are they going to come again. And they were, it brought humanity into a cold environment, because no one goes to hospital just for fun, okay, or just to have my body checked. I go there because I'm ill, because I'm sick, because I'm suffering, okay? And I think this is the easiest way bringing culture into the hospitals. And inviting actors or showing, I don't know, sculptures or painting, having an opening exhibitions. Of course, we have a problem of, let's say, keeping the sanitary norms. But doing it into the public spaces, it's like going into the mall or a theater.
And could you imagine that that you would have more of a permanent presence or more permanent collaboration with artists that would be working with patients in the hospital?
Well, we're having our first steps on a pilot program. I'm not going to talk about it because I like to present results, so it's not like fantasy. But this is one thing that we want to do, because we want to have it on a scientific basis, okay? So it's not just I go there once, I dance, everyone's happy, and then nothing happens. So we want to have it on a structural basis. We're going to give questionnaires, quality of life questionnaires, and others that are evidence-based, and then we're going to see what happens in time, okay? Because we want to contribute to the scientific evaluation of the scientific value of the projects. Because otherwise, if we dress good, smell good, everyone's happy. But we want these projects to be self-financed afterwards, because now they're on a volunteer basis, okay? But in the end, they will fall, because everyone has other important stuff to attend to, okay? So we want to, now, as I said, they're on a volunteer basis. The programs that you said in other countries are financed or socially reimbursed by the states in different ways. But as I said, on our pilot projects, we have identified 3 to 5 opportunities where we can do it, okay, like this. So we want to have replication.
Okay, good to hear. Edith, you wanted to add something?
Yeah, because we had, thanks to to Rarița and her team, we could visit the military hospital 2 days ago, and they have quite a lot of activities, artistic activities in the hospital already. And there was also a patient there who talked about her experience, and what I found touching that she said she has MS, and she comes every year, she comes to the hospital to get her treatment. And these artistic activities take her out of being a patient, you know, because when you have a chronic disease, everything is around your illness, but the illness may be 10% of your personality, there is another part, and you can bring that out with the arts. And I would like to support the call that Monica made to you. Go out and try to work in the field, because policy always follows up what is happening in society. So don't let the perfect be the enemy of the good, because once the politicians see there is a lot going on, they might respond eventually. But it is a long way. So we all know that. That we bring that out is just an encouragement for the policy level. And look, we are here.
Yeah, and maybe I want to add something about humanity, because it's so important to humanize the medical profession, including for the practitioners, because they are suffering as well. They are overloaded, they are in burnout and so on. So this part, I guess we are going to discuss it in the next divided panels, but this is something that is hugely important for us. And if we think from the cultural sector point of view, because you talked about instrumentalization, Edith, I mean, we have to think that we are linking these two human rights. So access to culture is a human right, access to health is a human right. If you want to think in terms of sustainable development, SDG 3, you know, health for all is an important one. And of course, we do not have a cultural goal among the ones that are currently there. But we have to connect all these dots, because maybe policymakers by themselves or politicians don't have the time, the experience to do it. And I think it's very noble for artists to say, I want to connect the access to culture, human right, to access to health, human right. So it's not about instrumentalization. Especially for young people, what we put in the challenges, in the opportunities that Edith was mentioning, is that this gives them the opportunity to develop their art and to, you know, get inspired by people that they never talk to. Hospitals, yes, this is a captive audience. Also prisons or old people's homes or you know, orphanages, whatever. We are talking now about sort of the most excluded people from society, but we not only thought about arts, culture and health at the individual level, but we also put it at the community level. So then you can talk about different types of communities on different, you know, criteria that, again, some of them are excluded from access to culture and access to health, so it's connected, as Rarița said. And then we talked about it as a general, at this societal level, so, you know, really like on a long-term investment in health, because participating in culture is a health behavior. So it's really strange for us, because we are so much talking about this, how sport is so ahead, like maybe 30 years ahead, because nobody is going to contest the fact that, yes, you have to make some physical movement, we call it physical activity, not necessarily, you know, sport, but, and it, in relation to cultural participation, this is not at all sort of widely accepted idea. So I think we have to take inspiration from our colleagues working in sport and physical activity and move into the same direction. And I mean, international organizations are helping. So if, you know, the WHO and the World Health Organization is saying, and they said it first, I mean, I think this is a very powerful tool to use with your colleagues that are maybe not so convinced, or the you know, medical personnel who say, oh, but this is an extra trouble, we have to manage all these new activities. Yes, but in the, you know, middle and long term especially, this will bring benefits. And like some interesting models for research that I found, you know, with the OMC group, we managed to visit different countries, and also with the Culture for Health project, we had different research meetings in different countries. And I remember we went to Aarhus, and there they had this project that I mentioned, music in the intensive care units, which I thought it was like the most impossible fortress, you know, people who come out of surgery or they have a life-threatening condition. Well, they bring young musicians because they have so the hospital has a collaboration with the Academy of Music, and one nurse is paid half to do a nurse job and half to do a researcher job. So this can maybe give you some ideas on how to measure in real time the impact on these patients, because indeed research is very important. Then you can take the results and say to, you know, decision makers, whoever they are, like, look, it's working from our point of view, like you know, heartbeat and whatever you need to measure. So there are always solutions, and our frustration sometimes is that we manage to meet these people, to see these solutions, and then we want to spread it as largely as possible, because it's hard today to find among this ocean of information the one that you need. But hopefully with this report and with, you know, continuing to work on these databases like Culture for Health, like what you do in care, also in the care project, you can keep this community of practitioners, of interested people around this axis of information and of mutual learning and inspiration, and you don't feel lost, because I can understand if you are, you know, an artist in Cluj and you want to start, where to start, how to start, what to do first. So these are ways to keep these learning hubs, you know, alive and be helpful for community.
Yeah, thanks. I want now to turn to the room and see if there are some questions or some aspects that you would like to bring into the discussion. Okay.
Thank you, Rarița. I'm so happy you turned to us exactly on this point, because I wanted to make a comment and maybe ask for solutions or ideas if you have. So I finished theater in Cluj as an actress, and I taught at the University of Theater, and then I went to London where I did my PhD in applied drama and diverse methodologies of theater and performance and storytelling involved with education and care, healthcare and so on. And when I returned back to Romania 7 years ago, I went back to the faculty. I started to teach again. And I also proposed on a master on different methodologies of how to apply theater and performance into the community and society. And I was told, actually, we're doing arts here, not social engagement, not other things. So my question would be, how do you deal with these power struggles? And how do you deal with a response like this? Because yes, it's great. We've been doing, and there are some initiatives in Cluj that have been doing art therapy, art as therapy. I've participating in the formation of artists who are engaging with different projects. And actually yesterday I met one of the ladies we've formed last year, and she was telling me it was so hard dealing with the people, engaging. Because I understand there is a need for a scientific backing in this, and it's great that you're doing it. So I hope.
Yeah. So your question is rather like how do you deal with being accepted in this system? I would just like to pass the microphone to Valentina because she's working at the University of Theatre in Bucharest, and they do have a strong community arts program there. So I don't know, also health related. So maybe you just say a few words just as a response. How is it accepted in the university there?
Yes, but I think we can delay. I like a lot sometimes to delay the answers. So we suspend the question and I will answer to you through the project that we are starting. And it's an open field where partners can come in. So it's really a possibility to make this project grow. The name of the project is CRESC, and it's an AFCN project. And already we gained some other partners during the process of working, actually, of acting out.
Yeah, and I think, for instance, in Cluj, I was very pleasantly surprised that in the past 3 years, both the Academy of Music and the University of Art and Design, they have dedicated courses to music therapy, artist therapy respectively. And when we were 2 days ago at the military hospital, we met representatives of both these universities and students actually working in the hospital, doing their practice for these disciplines. I think until we get to the point where we will have a full master's on this, I think there's a little bit of... I'm also advocating at the university for that, but I think it's going to take a bit of time. I'm just hopeful otherwise.
But this is also the role of this type of report, because sometimes you have to go around. If you cannot go straight up, you go you jump a couple of levels. So if you go to them and say, look, there is practice in EU member states, in other, like for example, I don't know, courses on mind, music, and medicine, and all kinds of other. I mean, for sure there are in theater as well. I just don't have one concrete right now. And you can say this is an accepted, policy approach at the European level. There are also so many initiatives at the national level, at the regional level, at the city level. So at one point, this gives you credibility. It's not like it's your idea coming out of nowhere. So I encourage you to use it.
Yeah, actually, you know that in Târgu Mureș, we have a Masters on Medical Humanities that is a partnership between the University of Medicine and the Faculty of Theatre, which in that case are part of the same university, so they are departments of the same university.
And I know there are different diplomas, because I think
Okay, yes, let's see, because I think we will touch on this subject in the next panel, so if there are some more points to add to the conversation that we already had. And Ligia, anyone else? I would like a show of hands who wants to say something.
I just wanted to say that our university already has a master in theater education, so I think it's very similar to what you proposed.
actually it's not, but that's a very different proposition, and
Okay.
I think that some colleagues work very hard for that to be actually accepted, and it's a very different perspective there.
Yes, but it is the first brick.
Yeah, we got the first brick, yeah, okay. Any other, it doesn't have to be a question, it can be a question, but it could be an experience that you want to share or a point that you want to raise to this conversation.
About Italy, my country of origin, there are some programs because the suicide is very high in the medical categories. So they start to make this kind of artistic programs for doctors. So arts, movement, everything can come from the cultural and art sector. So they are really active to help the medical, the doctors, the caregivers.
Yeah, great to hear. Actually, I know also in Milan of a great cinema therapy program in hospitals where actually you can go also from outside the hospital to join film screenings in the hospital to build a community. Please.
Maybe it's a little bit too specific, but I'm wondering about the role of the art institutes in this story, because we are talking about the hospitals. But what is the role of the cultural institutes, and how do they then support the artists reaching out into the health field, the healthcare field? And then also I've heard a lot of responses from proposals for projects that there is no money for an individual, like the audience and the reach for a project like this doesn't apply with, for example, the ticket sales that the typical performance piece in a black box situation would reach, and therefore art institutions are very unwilling to engage. I mean, this is a very local situation in Belgium maybe, but they're very hesitant to engage in this collaboration because for their dossiers and their reporting, the audience or the patient in this sense is just an individual thing, and it's not the same as a ticket sale for a black box context. So I was wondering how this conversation happens and how this collaboration works.
I wonder who wants to answer. Would you want to answer about the art?
Yeah, if I'm going to get invited to the next edition next year, I'm going to give you, because this is what I'm talking about. I'm struggling with this. I have found 3 to 5 solutions, but until everything is clear, I just don't want to say that I'm going to do this and not going to do it. But it's basically what you said. So if you can go like this, you go like this, or you go like this. So each time you find solutions. The important thing is to don't give up, because at some point you'll meet the right person at the right time who will be open to your ideas, and you can shift. Because, for example, if I want to bring, I don't know, opera in the hospital, but the director of National Theatre says, okay, I'm going to have a live performance with 2 actors. Yes, but I like opera. Then I'm going to accept his or her offer. And then I'm going to go to the director of the opera and said, look, your body came, don't you want to do this? And he will come. Okay?
Yeah, to be honest, I think what we learn from the practice is that actually it's mostly the cultural institutions and organizations that are willing to do this. So in most of the settings, national, local, it's mostly that the initiative comes from the cultural sector, and in such context we usually discuss how to get the doctors involved. So, but I see how it could be a resistance from cultural institutions, and I think to this discussion, I think on one hand what Edith said, that we are talking about the intrinsic value of culture at play here and ensuring the right to culture. So, for instance, like a pretty well-known example of projects is like museums that add to their audience development programs, like for instance museum tours for people suffering from specific disease, for whom the slow-paced encounter, mediated, yes, so it's not an unmediated experience, can have a beneficial role. So it doesn't mean that the museum has to step out of its role. It just has to extend to particular groups. And I also believe it's also related to different types of cultural organizations. In Romania, we have so many and diverse cultural organizations that I think their primary motivation is rather to engage socially than well, artists is probably not their top priority. But I think it's really important in this conversation that it means that we are not questioning at all that some cultural organizations don't have to do this. Yeah. Yes. Any other points to this? Well, if not, I would turn to you for like one quick thing from each of you, something in the direction of what would be one next step that you would like to see happening, or what you can do in your own immediate environment.
Yeah. Shall I start? Now, following this discussion here in Romania for the last 2 days, I think recognize, connect with your peers, connect to look for advocates, alliances, and complices to realize your projects and realize that you're doing your individual project, but you're really part of a movement that is happening now across Europe and across the world. So Culture for Health is coming strong. You're not alone.
Yes, well, there are so many things to do. Of course, in my job, I work a lot with colleagues from other departments of the Commission, so we didn't have time to talk today, but like research, Horizon Europe has huge funds compared with Creative Europe, so we are constantly lobbying for more research funds for this area, because indeed we need we have some research done so far, and this is reflected in the reports we talked about, but it's far from being enough. So we need to build on this research base for the next years. But we also need to work with member states, to have more political input from ministries of culture, from future EU presidencies. There are things happening in the parliament in the area of mental health. There is like an interparliamentary group on mental health. They had a forum a few months ago. So there are a lot of things to keep up with, and to a lot of people to meet and to explain and re-explain and convince and reconvince about the importance of these things. I mean, one thing that is very clear for me is that it is both important and urgent. Because if we talk about suicide rates, like I don't usually take this example from the medical profession, but I take the one from young people. For young people, I think between 12 and 19 years old, suicide is the second cause of death. And knowing that we can do something for these young people who are completely lost through participation in a cultural project, of course, in the right context, with the right training for the artists and so on. I mean, how can you not feel urged to do something? And that's just one, example from many that we can give. And so, yeah, a lot of work ahead to keep connecting people and keep sharing this report and to build up on much larger scale of projects and the funding in the future.
I'm going to be very brief. It is a hard question, but from my point of view, I think one of the most important things would be to increase the visibility of such actions, to find other people that are doing similar things, to be pushy, to shift, and to adapt if needed.
Okay, great. I will follow up on this because we were also speaking with Mrs. Baltarov, the manager of the military hospital, and so I think the next challenge from me towards you will be to get together with other medical professionals in different hospitals in Cluj that have already this openness to talk together to see what we can do beyond our immediate institutions. And because we were talking about the importance of raising awareness of around this idea that art is a health behavior, I want to share with you the fact that in the CARE project, we are currently carrying out an awareness raising campaign called More Arts, More Wellbeing, which is, it's at the European level, it's a social media campaign, it's based on research, so our messages are based on research, saying, okay, more engagement with museums means more connection in your life. More dancing, it means more physical activity, that's something you know is good for your health. More music, more joie de vivre, more visual arts, more happiness. So just as we are transitioning into the break, I will share the visuals on the screen. I will not take more time with that, but you will have it online to just see how the visuals are looking like, and you can look on the website culturecares.eu for all the messages of the campaign. Thank you so much for being with us to open today's conversation. I hope it was also an interesting conversation for you.